my name is Christian Ruff, and I'm the Director of General Cardiology at Brigham and Women's Hospital and a clinical trialist of the TIMI study group. Today on Clot Chronicles, we're going to discuss the biggest practice-changing trials presented at the 2019 European Society of Cardiology. It was really an incredible conference, and there were really kind of four, key studies that changed the way we think about treating patients with cardiovascular disease. Two were with respect to heart failure. One was the Paragon-HF study, which was a follow-up of the sacubitril/valsartan or ARNI therapy for patients with heart failure. Previously, there had been a blockbuster trial that showed in patients with heart failure and reduced ejection fraction, those with an EF of 40% or lower, that the addition of sacubitril/valsartan significantly improved outcomes in patients with heart failure, reducing cardiovascular death and heart failure hospitalization. This trial was essentially a similar design except looking at the other end of the spectrum. Patients with heart failure with preserved ejection fraction, in this trial defined as an EF of 45% or greater. And the overall trial, there was a non-significant 13% reduction in total heart failure hospitalizations and cardiovascular death. And so technically a neutral study. There were some very interesting subgroup findings that suggested there may have been more benefit in women compared to men, and also in patients who had mild reductions in systolic dysfunction between 45% and the median of the trial, which was 57%. I think this trial underscores two important principles. One, HFpEF is just a very different patient population than HFrEF, and that within heart failure with preserved ejection fraction, it's a very heterogeneous patient population, and we need to do better to figure out the differences between these patients as they respond differently to our guideline recommended therapy. The second major blockbuster finding, really probably the largest finding at the study, was the DAPA heart failure study, and that was studying the SGLT2 inhibitor, dapagliflozin, in patients with heart failure with reduced ejection fraction. Now, we know that these class of drugs are glucose-lowering drugs that were initially studied in diabetics, and they were shown in patients with diabetes. They prevented heart failure hospitalization and cardiovascular death in patients with a history or no history of heart failure. This was a dedicated study in patients with heart failure with reduced ejection fraction and showed an overwhelming benefit for reducing heart failure hospitalization and cardiovascular death, regardless of whether the patients even had diabetes at baseline. So this is really a game-changing study, and I think that this therapy, which was initially developed as a diabetes medication, will be used for the treatment of patients with heart failure with reduced ejection fraction. The next blockbuster finding was actually a genetic study, a Mendelian randomization, that helps inform us what lifetime treatment of blood pressure and cholesterol might do for individuals in a population. And this was a study that looked at genetic variants that predisposed individuals from the UK Biobank to lower LDL cholesterol, lower systolic blood pressure, or both. And it found that variants in a genetic score associated with lower blood pressure and lower cholesterol resulted in a substantial lower lifetime risk of developing cardiovascular disease. And this is an incredibly important study because it informs that even modest reductions in blood pressure and cholesterol can have substantial reductions in lifetime cardiovascular morbidity and mortality. What we really need to do to transform this into practice is to confirm that pharmacologic treatment of blood pressure and cholesterol will lead, over a long period of time, decades, will lead to these same robust findings and essentially preventing the progression of coronary disease. So really practice-changing implications. And along the lines of cholesterol, there was actually very exciting breaking science regarding a novel way of lowering LDL, or the bad cholesterol. And we know that statins lower bad cholesterol as well as the PCSK9 antibodies. And there was the presentation of the Orion 11 data, which was a novel PCSK9 inhibitor, actually a small interferon RNA that is only given twice a year. And these were the LDL lowering results that suggested that giving the small interferon RNA can actually lower LDL persistently by about 50%. So really a incredible technological advance, very exciting for patients when we think about compliance, only giving a drug twice a year, and there is a large outcome study that obviously will need to be confirmed that lowering LDL by this mechanism leads to the expected reduction in cardiovascular events. So an incredibly exciting ESC, and I think several studies that really change how we treat and protect patients from cardiovascular disease. So thank you for Clot Chronicles. This is Dr. Christian Ruff.